Hi everybody. So IPL season is back. So is our sporting culture back now. And in such a pandemic, it's good that everybody will now in the next week wanting to go and be more fit and do some sports further. Today we are going to talk something on sports injuries and how do we prevent them. And I'm going to be specific about one injury, which is the ACL tear. And I'm going to talk on the prehab point of view of the ACL tear. First of all, let's talk about the ACL tear in itself. ACL is the strongest ligament in the body which is present in the knee, and many of you might have encountered or have done an MRI in the past also which says that there is a partial tear or there is a complete tear. Along with an ACL tear, your MRIs might read that you have a meniscus tear, which is the disc present in the knee. So you have all these complicated MRIs which you have been working around with, and you feel an on and off pain in your knee or the locking of your knee, or you have encountered that your speed in running or playing sport, or you're not stable at the knee, you tend to fall down. These are the symptoms which you've been experiencing with. And your doctor might have told you that you need to operate on it or you need to do a surgery, but you are skeptical of doing that. That is what I am going to talk today on, something called as prehab. What do I mean by prehab? Prehab is basically preparing you for surgery, or in some cases even helping you to avoid surgery. Now say for example, if you have a complete tear of your knee, okay, and your doctor has told you that yes, you have to do a surgery and you need to get operated on, and you have decided, okay, you have to get operated, but you are skeptical whether the operation will help me, or after the operation will I be going back to my sport better, or will I be affected in my sports because of the surgery. So that is where the concept of prehab is there. You prepare yourself for surgery, so you are actually gaining strength, you're gaining mobility, you're gaining stability, you're gaining endurance, and you're gaining functional movement. That means you are training yourself as sport specific as you can be even before surgery, so that the results after surgery are more better, are excellent, and almost near 100%. Okay, so an ideal prehab is around 4 to 6 weeks. Now in our coming videos, we will be posting the different forms of prehab which we are doing at our center. So you will feel that you will be able to understand that the patient looks like as healthy as he is, and he feels like, you will see that they are just going back to sport, they are doing that kind of training, but we are actually doing a prehab on that. So prehab is very important if you are planned for any knee musculoskeletal injury operation or surgery. It could be a simple meniscus tear, this could be a ACL tear. So for any knee surgery, before any knee surgery, you need a good prehab. What is there in a prehab? Now let's discuss that. Now you might have observed that if you have a knee injury, the bulk of your muscle, the bulk means the size of your quadriceps muscle is lesser as compared to your other side. Your stability at the knee, that means your balance strategies at the knee are poor. Your coordination and agility, three-dimensional movements, are painful, and you can tend to have some sort of swelling. So prehab actually takes care of that. We increase the bulk of your muscle via different techniques like a blood flow resistance technique, cupping technique, and cupping with exercises, and an advanced exercise program. Balance strategies have been worked on. We do a lot of functional training, for which in the future we will see a further post which will show the functional training which is done in the prehab. A good prehab gives you the best result post surgery. How do I say that? Say for example, if you have not done a prehab and you're scheduled for an ACL surgery, so what happens after an ACL or after any surgery of the knee, you tend to feel pain, you tend to feel stiffness, you tend to feel weak, and it takes on for like good nice 1 month of yours. But a good prehab done you do the surgery, you're back on your feet to do a rehab within 3 to 5 days. So within 3 to 5 days, you will be back to doing your exercises to get you back to sports. Also, a good prehab gives you a good stability for the surgeon to actually operate upon. So any grafting done or any tissues to be played around with, the cutting of the tissues will be much more stronger to heal after surgery if a good prehab is done. So importance of prehab is of utmost importance. I would say that a prehab should be done. In certain cases, if you have a partial tear or if you have a meniscus tear, and it's a complex thing which the surgeon is also not very sure whether to operate or not operate. So good prehab, which can be converted into a rehab, can also help you avoid injuries or avoid surgeries to be done. So in that way, a surgeon can also take a call. So as I tell my patients, a good surgery is only effective if a good prehab and a rehab is done. Okay, so it works both the ways, 50-50. A good surgery will be, you can call a surgery good only if there is a good prehab and a rehab to back the patient with. So in the further post, you will be seeing what a good prehab looks like.